Thank you for inviting me to speak at the annual conference of the Virginia Free and Charitable Clinics. Throughout my district in Central Virginia and the Commonwealth at large, free clinics are an essential part of the healthcare safety net in the communities that they serve. In 2018, the last year for which the Census Bureau has data, 731,000 Virginians were uninsured. Since Medicaid expansion went into effect in 2019, that number has decreased significantly, but hundreds of thousands of individuals remain without health insurance. And that number has no doubt increased during the ongoing pandemic and economic crisis, as Virginians have lost access to employer-sponsored insurance due to layoffs, furloughs, and economic hardship. Heading into the next Congress, expanding access to affordable healthcare will continue to be one of my top priorities. I recognize and appreciate the crucial role free clinics play in providing care for the most vulnerable among us. Last November, I enjoyed visiting several free clinics across our district, including the Free Clinic of Powhatan, the Orange County Free Clinic, the Free Clinic of Culpeper, as well as others that I visited in the past. I'm immensely proud of the role that Virginia's free and charitable clinics have played in response to the COVID-19 pandemic. And I am deeply troubled by the disparities that we've seen in COVID-19 transmission and outcomes in racial and ethnic minority communities during this pandemic. Free clinics are on the front lines of efforts to address these disparities, and I applaud your service to our community's most vulnerable members. In May, I held a call with several clinics in the district to learn what support they and the patients they serve needed at this time and continue to need during the COVID-19 crisis. And they told me about how COVID-19 has caused their financial situation to worsen as charitable giving was declining and health expenses increase and demand for services surges. And I was proud to advocate for Governor Northam to consider the vital role that Virginia's free clinics play in improving access to care and COVID-19 testing during the pandemic, especially for our most vulnerable communities. At the federal level, I led a bipartisan letter from the Virginia delegation urging Secretary Azar to release funding from the CARES Act to support free clinics and their COVID-19 responses. I joined with a bipartisan group of colleagues to introduce legislation to provide an additional $200 million for the FCC COVID-19 telehealth program, which would support free clinics and other providers' abilities to stand up a robust telehealth program, such as remote patient monitoring, keeping patients and providers safe during the pandemic. I look forward to that bill's inclusion in a future comprehensive COVID-19 package before the end of this year. And I will continue to fight for providers like all of you who serve members of our community, often the most vulnerable, and to make sure that you are not left out of federal relief efforts. Finally, my office stands ready to help you as you coordinate with other important actors in the healthcare system, such as the state government, the university labs and hospitals, and the federal government. I thank you again for all that you do on behalf of the people that we both serve. Thank you so much.